Thank you for staying with us on Citizen Sunday Live. A deadly cultural practice among sections of the Kamba community believed to ease teething in infants has left a trail of tragedy in Makueni County, with several children losing their lives. For generations, gum cutting was carried out under the belief that it hastened the sprouting of milk teeth and relieved symptoms such as fever, diarrhea and vomiting, often wrongly linked to teething. As our health reporter Emily Chebet reports, the Makueni County government is now considering a law to curb this practice, which has already claimed the lives of hundreds of children.
Here in Kithiaka village, Makueni, we meet Regina Kimondio, once a respected gum cutter, now racked in guilt and regret as she recalls how a decision to advise her daughter-in-law ended in tragedy, costing her grandchild's life.
Akashikwa na kuhara na kutapika. Huyo mtoto akaona ni kama ako na shida ya meno. Akachukua ile inaitwa hastened na sodamid. Akasukua meno. Wakati alimsukua meno, huyo mtoto alikuwa seriously mgonjwa.
For decades, gum cutting was seen as a remedy for teething issues in children, but health experts warn that the crude procedure carried out with razor blades, bicycle spokes, thorns or even nails exposes infants to severe infections, excessive bleeding and sometimes death.
Kitambo wakati nilikuwa nazaa mimi, nilikuwa natoboa meno. Unachukua yati, unatoboa na unasugua kidogo, alafu ile ndamu ikitoka tulikuwa tunaamini huyo mtoto hatasumbua na meno.
Between 2023 and 2024, Kibwezi Sub-County Hospital alone received 77 cases of gum cutting, with 5 babies tragically losing their lives. By July this year, the county had recorded 37 admissions related to gum cutting, including 3 deaths.
The mothers don't volunteer the information. It is only from examining that you notice that they have done gum cutting. The instruments that are used, what I've said, the thorns and the blades, are not used for one child. You'll find that it's used for many children. So this poses a risk, number 1, for infection because the instruments are not sterile, and number 2, for cross-infection. Children can get infections like HIV and hepatitis.
Phyllis Mwikali and her baby have been here in the hospital for 6 days. Her baby is a victim of this cultural practice, but fortunately, he was lucky to reach the hospital in time.
Ni mother-in-law wangu, so venye aliona situation ya mtoto anahara, kutapika, yeye kwa fikira zake akadhania ni meno. So like alienda akachukua hiyo surgical blade, alinunua, but hata hakuchemsha ile kuboil, akamkata na akagagul na hiyo hastened.
So they came with diarrhea and vomiting and difficulty in breathing. We put the child on oxygen for 3 days. We also did fluid resuscitation, and we started the child on antibiotics.
The Makueni County government, led by Deputy Governor Lucy Mulili, is actively working with mothers and healthcare facilities to put an end to this harmful practice. The Deputy Governor says it has become a growing burden on the county's health resources.
It's quite concerning when you find a young woman aged 18 or even 20 years at such an age, but again, because of the cultural norms, you find them being compelled by the parents or the older generation to cut the gums of their children.
The Deputy Governor says the county is now looking to introduce a policy that will outlaw this brutal practice, even as they engage reformed gum cutters and community health promoters to reach out to the grassroots levels.
We have lost babies as a result of the practice because it becomes septic, they have fever, and when you combine that with the malnutrition, because you know this is a food deficient area, it becomes even more acute. When we do the costing of the babies that have been admitted in the various level 4 hospitals, the many days they have stayed, it's a cost.
We advise them on use of warm water that has salt. They can try to nab the gums with a clean cloth, or they can also use the Dentinox gel. And for children who are big, we also advise them to use carrot They can give the child a clean carrot, and then the child will bite the carrot, or they use the plastic teethers. But the key emphasis, even as they are doing that, is on hygiene.
As Makueni County works to end this dangerous tradition, health experts and leaders urge communities to embrace safer modern alternatives for teething. With ongoing efforts to pass legislation, the hope is to protect children and prevent further loss of innocent lives. Emily Chebet, Citizen TV, Makueni.